Welcome to the Battlefield Acupuncture course. This course is based on the protocol developed in 2001 by Dr. Richard Niemsau and is presented with his permission. Please take a moment to review the usual disclaimers regarding views, opinions, and commercial products which are mentioned in the presentation. You are learning a limited ear stimulation technique for the treatment of pain. This training does not make you an acupuncturist or allow you to obtain licensure in acupuncture. You will be credentialed in this technique only. Once you see how valuable this technique is, you will surely be tempted to teach your colleagues. Although the procedure is simple and elegant, there is depth to it, and even more depth to teaching it. Only training by a sanctioned instructor will be recognized by hospital credentialing authorities, just like CPR or ACLS. In today's presentation, we're going to go over the history, theory, and evidence for battlefield acupuncture. We'll help you appropriately select patients. We'll go through the technique and aftercare in detail, and we'll finish with a brief wrap-up. The practice of Oriental medicine, including acupuncture, was developed between 5000 BC and 3000 BC. We know that the ear was used for acupuncture outside of China as early as 1500 BC in ancient Egypt. The earliest Chinese book detailing the practice of ear acupuncture dates to 770 to 221 BC. Dr. Paul Noger, a French physician, is considered to be the developer of modern Western ear acupuncture. Through centuries of experience, acupuncturists discovered that there were areas of the anatomy onto which the entire body was mapped, allowing stimulation in one place to strongly affect problems far away. The Chinese and French have mapped the whole body onto the ear, the Japanese onto the scalp, and the Koreans onto the hand. There is scientific evidence indicating that there is somatotopic correspondence between regions on the ear and areas of the body, and that therapeutic benefit is derived distantly when these ear zones are treated to relieve pain and other symptoms. In fact, these have proven to be some of the most effective and rapidly acting treatments in all of acupuncture. Battlefield acupuncture is a specific application of ear acupuncture which was developed in 2001 by Colonel Richard Niemsau, an Air Force physician. He is considered a pioneer of modern medical acupuncture. He discovered 5 ear points treated in an elegant sequence of semi-permanent needles which produced rapid, effective, and often amazing pain relief. He coined the term battlefield acupuncture, reflecting the fact that this technique is ideal for use in austere environments, requiring only access to the ears and 10 not tiny needles. Here are the 5 points Dr. Niemsau selected and sequenced. Dr. Z.H. Chow utilized functional MRI studies to demonstrate the effects of acupuncture on the activity in the brain pain centers when pain was being experienced. The brain image on the left is from a normal subject who has received a painful stimulus involving hot water. The bright yellow signal reflects a moderately high level of brain activity in the pain modulating centers, the cingulate cortex and the thalamic nuclei. The brain image on the right is from the same subject who received the same painful stimulus and acupuncture at the cingulate gyrus and thalamus point in the ears. You can see that there is significantly less brain activity in the pain centers. Here is a series of patients treated by Dr. Niemsau with the battlefield acupuncture protocol. All of them had not responded to traditional Western interventions for their pain. Note the variety of conditions, durations of pain, and ages. Also note patient 4 who actually had worse pain on follow-up than on presentation. This happens, but not often. This is a graphic representation of the case series we just looked at. Note the dramatic reduction in pain immediately after the BFA treatment. This is an example of how patients can return to duty or other activities quickly after being treated without the side effects of strong medication or other treatments. The numbers on the follow-up bars represent the number of days after treatment that the pain was assessed. There are many high-quality clinical trials and peer-reviewed literature which demonstrate the effectiveness of battlefield acupuncture in reducing pain and in reducing the use of pain medicines. This is the beauty and elegance of battlefield acupuncture. It can be applied in any environment where you can expose an ear. The tools are pocket-sized, sealed, and sterilized. And most important of all, you'll see that it is quick and easy to do, extremely effective, 80% of patients respond, and it is safer than most other interventions you have to manage acute and chronic pain. Any adult patient with pain, regardless of medications or diagnosis, may be considered for battlefield acupuncture. At your discretion, very mature adolescents, age 15 or older, who have the consent of their guardian, may be considered. In the clinic setting, patients should exhibit the ability to monitor for the rare instance of inflammation at the treatment site and be able to follow up by phone, video, or visit. There are points on the ear which can strongly impact pregnancy. Unless you are a fully trained acupuncturist, you should not perform battlefield acupuncture on patients who are pregnant or who might be pregnant. An allopathic diagnosis must be made for conditions treated with battlefield acupuncture. Battlefield acupuncture is strong enough to lessen the pain from prostate cancer, which is spread to the bones of the back. While having an absolute diagnosis is not necessary to proceed with battlefield acupuncture, you must be doing normal medical diligence to arrive at the cause of the pain. Patients who have an aversion to needles or a history of vasovagal response to needles should not receive battlefield acupuncture. You should never insert an acupuncture needle into an ear with any sort of infection. Patients with a bleeding disorder or who are taking blood thinning medications or injections are at risk for increased local bleeding, bruising, or oozing with needle insertion. This is only a relative contraindication, but the increased risk should be considered by the provider and discussed with the patient. Retained ASP needles are not considered safe during an MRI exam. There are duty restrictions which apply to aviators and other special duty personnel who receive acupuncture. Acupuncture treatments on any member on active flying status or other special duties, such as Personal Reliability Program, PRP, Presidential Support Duty, PSD, Remotely Piloted Aircraft, RPA, Ground-Based Controllers, GBC, Missile Operation Duty, MOD, etc., must be coordinated with the member's flight surgeon or responsible provider. In the event special duty personnel are seen in a Veterans Administration hospital, the same requirements apply. Over many years, and literally thousands of patients, Dr. Niemsau and his colleagues have found that 80% of patients will respond to battlefield acupuncture with a reduction in pain. A small percentage of patients do not respond on the first treatment, but will respond after subsequent treatments. For reasons that remain to be discovered, some patients do not respond at all, and there's no way to predict who will respond and who will not prior to initiating treatment. Initial pain is generally for 1 to 3 days. Follow-on treatments will often provide progressively longer relief of the symptoms. Acupuncture has a long history of safety, and side effects are very uncommon. The column on the left describes effects that we sometimes see. The column on the right shows effects that are exceedingly rare, so rare that many who practice battlefield acupuncture will never see them. Among the uncommon side effects is discomfort at the needle site. The needles are a bit uncomfortable on insertion, but this discomfort normally wears off after a short amount of time. If the needles are brushed by a towel or pressed on by a pillow, some discomfort may occur. Sometimes the needle insertion site will become red and warm after the needle is inserted or if the needle is brushed against. This brief inflammation resolves without intervention. We have already discussed the risk of bleeding and bruising, particularly in patients who have bleeding disorders or who are taking blood thinning medications. Some patients experience euphoria during the treatment. This is thought to be due to the release of endorphins and enkephalins in the central brain, similar to the sensation of the runner's high. If your patient becomes giddy, keep them in the clinic until the symptoms have resided. Occasionally, a patient will become lightheaded or feel dizzy during the treatment. Monitor closely for the development of this symptom, and if it occurs, do not place any more needles. The needles you have placed may be left in. On the other hand, very uncommonly, a patient may either feel faint or even faint. If this happens, lay the patient down, remove the needles you have placed, and support the patient with rest and water, just as you would treat any patient who is either presyncopal or syncopal. Discoloration or keloid formation can occur with repeated needle placement over time. Some patients are predisposed to keloid formation, African Americans in particular. We have found that by having the patient remove the needles after 24 hours, or by having the patient return to the clinic for needle removal, keloid formation in high-risk patients can be avoided. It is important to counsel all patients about this risk. Some patients will experience a tremendous emotional release when decades of pain melt away in a matter of seconds. They can be joyful and even tearful. Infection is extremely rare, so rare, in fact, that Dr. Niemsau and his colleagues have never seen an infection from a BFA needle. Fainting is also rare and should be managed as just discussed. A few patients will experience excessive sweating during the treatment. This is not a cause for concern unless it is accompanied by lightheadedness, dizziness, or fainting. Finally, rarely during a treatment, a patient's symptoms will become worse instead of better. If this happens, remove all the needles you have placed and consider trying the treatment again on a different day. Obtain informed consent by having the patient read the Battlefield Acupuncture Patient Education handout and then going over the consent form in detail, answering any questions. Consent may be written or verbal, depending on institutional policy. Here's how we'll spend the rest of our time together. We'll begin with an orientation to the special needles used in battlefield acupuncture. Then we will review important ear anatomy. Next, we will learn each of the battlefield acupuncture points in the proper order with attention to finding the zone, needling the points with good hand support, and needle approach. Finally, we'll discuss the battlefield acupuncture treatment from beginning to end. Let's start with a look at the needles. ASP needles come in boxes containing 80 or 200. Inside the box, you'll find dots, which can be used to cover the needles if the patient desires. The needles are enclosed in an injector and packaged in a sterilized strip of 8. To release a needle, simply push away and an injector can be removed. In order to appreciate the size of a needle, Dr. Niemsau will place one next to a penny. One way to insert the needles requires 2 fingers. Dr. Niemsau will now demonstrate the 2-finger technique to insert an ASP needle. Note that the injector is held between the thumb and index finger. The needle is placed perpendicular and pressure is applied. The needle is inserted. Another technique requires 3 fingers. Dr. Niemsau will now demonstrate the 3-finger technique. Note that the needle is held between thumb, index, and 3rd fingers. The needle is placed perpendicular to the apple, pressure is applied, and the needle is inserted. The helix is the outer cartilage ring of the ear. It winds around anteriorly to the root of the helix. The apex is the most superior aspect of the helix. This anterior structure is called the tragus, and it is symmetrical with the antitragus. Between the tragus and the antitragus is the intertragal notch. Finally, the antihelix rests anterior to the helix and splits into a superior and inferior crus. Between these is a valley called the triangular fossa. Here are the 5 points we will needle in performing battlefield acupuncture. Note that the yellow circles representing each point are somewhat large and represent a zone rather than a very small point location. This is because the precise location of the point differs from person to person. However, if you needle within the zone, you are likely to get a good effect. This is the first point in the battlefield acupuncture sequence, cingulate gyrus. You can see that it is located in the region of the intertragal notch. You will find the point zone by going straight inferior from the middle of the tragus, finding the cartilage ring, and inserting the needle into the skin just anterior to the cartilage. Watch as Dr. Niemsau places a needle into the cingulate gyrus point using two-finger technique. He will stabilize the ear, place the needle perpendicular, apply pressure, and the needle is inserted. Here are 3 more examples of the cingulate gyrus point. This is the second point in the battlefield acupuncture sequence, thalamus. You can see that it is located in the antitragus. You will find the point zone by splitting the antitragus vertically and horizontally and inserting the needle at approximately the intersection of the 2 lines. This point is placed from a lateral approach. Needling the top of the antitragus is not effective for pain. Dr. Niemsau will now demonstrate the insertion of an ASP needle into the thalamus point using two-finger technique. He stabilizes the ear, places the ASP injector perpendicular to the skin, and applies pressure. The needle is inserted. Here are 3 more examples of the thalamus point. This is the third point in the battlefield acupuncture sequence, omega 2. You can see that it is located on the superior aspect of the helix. You will find the point zone by splitting the distance between the apex of the helix and the spot where the helix inserts into the face.
I'm going to demonstrate the insertion of a gold ASP needle into omega 2 using a two-finger technique. On the left ear, I grasp the helix with my thumb and index finger. I take my left hand with the gold ASP needle. I place it halfway down between the apex of the ear and where the ear attaches to the scalp between my thumb and index finger, press the needle, and insert the gold ASP needle.
Here are 3 more examples of the omega 2 point. This is the 4th point in the battlefield acupuncture sequence, point 0. You can see that it is located in the root of the helix. You will find the point 0 zone by locating the groove in the cartilage of the root and placing the needle into the root 2 to 4 millimeters posterior to the groove.
I will demonstrate the insertion of a gold ASP needle into point 0. I take my left hand, I stabilize the ear, and with my right hand, using a two-finger technique, I locate posterior portion of the root of the helix. I place the gold ASP needle and gently push.
Here are 3 more examples of the 0.0 point. This is the 5th and final point in the battlefield acupuncture sequence, Shen Men. You can see that it is located on the outer margin of the triangular fossa. You will find the point zone by locating the apex of the superior and inferior crus. Place the needle 1 to 2 millimeters anterior and 1 to 2 millimeters superior on the downslope of the superior crus near the apex.
I'll demonstrate the insertion of a gold ASP needle using a 2-finger technique on Shen Men. I brace the ear with my right hand, take my left hand, and gently insert the gold ASP needle on the triangular fossa.
Here are 3 more examples of the Shen Men point. And finally, a picture of all 5 points. When doing battlefield acupuncture, you needle right and left cingulate gyrus points before proceeding to the thalamus. Hence, the acronym should be CC, TT, OO, PP, SS. Here's the sequence for battlefield acupuncture. Select your patient with care, considering the indications and contraindications. Obtain informed consent using the patient handout and the consent form. Note the initial level of pain on the 0 to 10 scale. We recommend that you use the Defense and Veterans Pain Rating Scale for consistency and to facilitate future battlefield acupuncture research. Your patient should be sitting or lying down. Wash your hands and clean the patient's ear with an alcohol pad. Place the needle in the cingulate gyrus point on one ear with proper ear support and insertion technique. Have the patient walk for a minute or so, as this tends to activate the needle, perhaps by enhancing circulation of released biochemicals. For the first few needles, walk with the patient so you will be there in the event of lightheadedness. On return from the walk, reassess pain level. If the pain is 0 to 1 over 10, the treatment is complete. If the pain is greater than 2 over 10 and the patient is willing, place the cingulate gyrus needle in the other ear. Repeat this process in sequence until you reach the desired pain level. Cingulate gyrus, thalamus, omega-2, 0.0, then Shen Men. Document your note in the health record. Suggested notes and codes are included in the protocol booklet. There are several reasons to stop a battlefield acupuncture treatment. Of course, if the patient asks you to stop, then you should stop. If you've reduced the pain to 0 to 1 over 10, you should stop. And as discussed earlier, if the patient experiences significant lightheadedness, stop the treatment and attend to the patient. When the treatment is complete, recommend that your patient take an easy day. No strenuous exercise or heavy house or yard work. Avoid any excesses on the day of the treatment. Patients should be advised to eat healthily and moderately. They may return to normal activity the day after the treatment. Advise the patients that the needles may fall out by themselves in 2 to 4 days. It is safe to shower, swim, and get them wet. If the ears get wet, it's best to blot them dry to minimize irritation of the needles. If brushed against, they might be uncomfortable. If discomfort is causing distress, needles may be removed with fingernails or tweezers. Children can get grabby with the needle, so ask patients to use caution when picking up young children. Once the needles fall out, they can be disposed of in a container with a lid. If your patient sees signs of inflammation, redness, tenderness, or drainage around a needle, have him or her remove the needle right away and arrange follow-up with you. Patients should always continue prescription medications unless specifically advised to stop by their regular doctor. Ask your patient to keep written notes of their response to treatment, daily recording of pain level on the 1 to 10 scale, and notations on other symptoms, sleep, well-being, and energy. Ask your patient to bring these along to the next visit. Remember these important points. Be sure you have a diagnosis you are comfortable with. Work with clean hands and a clean ear. For best results and to use the least number of needles, we strongly recommend not deviating from the protocol on a new patient. However, circumstances may dictate an expedited treatment, especially with patients who have had multiple past treatments. Walk the patient after each insertion. Always assess the patient, place a needle, reassess, and decide whether another needle is needed. Know when to stop adding needles. Combining this presentation and the student materials, you have everything you need to know to be successful on the written examination. According to the instructions you have received, please complete and submit the test. Congratulations. Your next step is to attend the hands-on training as it has been arranged for you. Once you've completed that portion of the course, you will receive a training certificate and credentialing letter. The next steps are to apply for privileges using the credentialing letter, and then practice, practice, practice. This wonderful treatment is just the tip of the iceberg on how you can help your patients. We hope you will grow your interest and decide to become a fully licensed medical acupuncturist. Thank you for the opportunity to teach you. If you have any questions at all between now and your hands-on session, please reach out to us using the contact information you have been given. Good luck.